Healthcare itself, if you look at it, it went overnight to a virtual care model. And I don't know how far along Northwell Medicine was in terms of its journey towards a telehealth mode of delivering care. But I imagine, like as with other health systems across the country, whatever it was has accelerated significantly, I imagine. Could you talk a little bit about what some of those big changes were from point of view of just virtualizing your care delivery?
Northwell has been a leader in telemedicine for, I would say, last 5 or 6 years. And we have used telemedicine capabilities across our system very effectively. Teleradiology, telepsychiatry was a major component of it. And we had, and also our transitional care workers use the telemedicine to a great extent to follow up on the patients who are high risk. And also we use it extensively on our readmissions task force and making sure that the people are really taken care of. Having said that, this particular way of it accelerated tremendously after our experience with this with the coronavirus. Now people do not. There was a little bit of reluctance on the part of the patients adhere to this telemedicine concept, but this pandemic actually opened the eyes and it made it more normal for the patient perspective of able to get on a telemedicine call and able to chat with the patient. So the new normal going into the future will be, there'll be less reluctance and there is a huge cultural change which has happened, and people will be, getting more and more care and consultations through this virtual technology to a great extent. So we believe that, and Northwell has done that before, so we need to gear this up. That simply means most of the healthcare delivery systems in this country has got to really change their workflow issues. There may not be as many patients who will be coming to our regular clinic, and there may be a good number of people who will probably be seeking care and getting advice through virtual technology. So that simply has got different kinds of processes we need to evolve. We need more of people who are having the telemedicine concept. That means we need more hardware, more software, and more situation room kind of things where we are able to guide the patient through the system effortlessly and with a minimal delay. But at the same time, on the flip side, the real estate value of having these large clinics with the large waiting rooms and all those things need to be rethought, because there may not be as many people coming through to occupy those waiting rooms in the large clinics, which some of the hospitals have built very recently, to accommodate more flow. Yeah. So we need to really figure out how do we make the shift from face-to-face medicine to virtual medicine and all the implications which come with that. We need to gear up certain areas of our system to accommodate high demand on the virtual, doctor's visit, and we may have to shut down some areas of the healthcare delivery system which will not be needed as much in the new normal after the coronavirus.
We hope you enjoyed this podcast. Subscribe to our podcast series at www.thebigunlock.com and write to us at info@thebigunlock.com.